Hello, my name is Ted Mayerson. I'm a volunteer with AARP Maryland, and I'm here at the Maryland Institute for Emergency Medical Services Systems talking with Dr. Ted Delbridge, the Executive Director. And the purpose of our being here today is to try to determine, Doctor, what is MIMS?
Well, every state in the country has an agency that is designated to be the lead agency for emergency medical services in the state. The agency that puts together the structures and processes that makes it possible for the folks in the field to deliver high quality, consistent care to the people who need it. And in Maryland, that is MIMS, the Maryland Institute for Emergency Medical Services Systems. I'm an emergency physician. I work closely with a state EMS medical director who is also an emergency physician and a staff of about 100 people that make the pieces possible for the 27 jurisdictions in Maryland to deliver high quality emergency medical services care in the field. And we put the pieces together by providing the processes that credential EMTs and paramedics. So we certify and license nearly 20,000 emergency medical services clinicians, emergency medical responders, emergency medical dispatchers, EMTs, cardiac rescue technicians, and paramedics. And they're the people that you see in the field delivering care. We ensure that they are qualified to do what they do and keep track of their credentialing throughout their careers. Many of them are volunteers. Many of them are career personnel who work, for example, the Baltimore City Fire Department or other jurisdictions in the state. Many of them are both. They are career people in one place, and they lend their expertise and time to be volunteers in their local communities. We operate an emergency medical services communication system. We have radio towers throughout the state. We're in the process of a multi-million-dollar upgrade to that system to make it more modern. But that enables a paramedic who's in Cumberland, Maryland, to talk to a trauma surgeon here at the R. Cali Shock Trauma Center to help determine what the appropriate care for an injured person is and where the right place for them to go is. That is staffed in our building 24 hours a day, 7 days a week, 365 days a year with telecommunicators who can patch that communications network together. We're also in concert with the Maryland State Police, responsible for dispatching air medical resources to the scenes of serious injuries and illnesses. There are 7 state police helicopters stationed throughout the state. We have the responsibility, again with the Maryland State Police, to receive calls from 911 centers, to dispatch those resources appropriately, and make sure that the helicopter gets to the scene and gets to the hospital where it's taking the patient safely. We are responsible for designating the specialty care centers in the state, the trauma centers, the cardiac intervention centers, stroke centers, and high-level perinatal centers. We share that responsibility with the Department of Health. And so we view emergency medical services as the care that is delivered to the patient from the time of their accident, from their injury or their illness in the field until they are at definitive care. We work with our hospital partners on a day-to-day basis to ensure that we have a system that envelops the population of Maryland, the more than 6 million people who live there and our visitors.
Well, let me ask you this question. If I were to ask my wife to call EMTs because I'm having chest pains, do you send somebody out?
No. Where do you live?
In Howard County.
So you would call, so your wife would call 911. The call taker, the emergency medical dispatcher, is somebody that we have credentialed to be an emergency medical dispatcher, meaning they have special knowledge about how to query, how to get the information that's necessary to send the most qualified help to your home and provide instructions to your wife on how to care for you until help arrives.
Do you train, or do they get training anyplace else and have to be certified?
They get trained someplace else and get certified. Okay. And then we stipulate what their continuing education requirement is to stay up to date with the goings-ons.
Wow, that's a terrible responsibility.
Well, I have an awesome team that makes this all go. And we work really closely with the 27 jurisdictions that are the ones actually providing the service in the field.
Well, I fortunately have very little experience with that kind of service, but a son-in-law tripped on my front step and ended up with a broken hip. And we called 911, and somebody was there within 3 minutes, it seemed, which was amazing. And if that's the kind of training and the support that you give to people, wow, that is really terrific, and people should know about MIMS.
Well, we're just the infrastructure. Really, if you had that experience in Howard County, it was because of the really hard work that the folks in Howard County do and the pride they take in the service that they provide to their citizens. But that is true throughout the state. And part of what we do is ensure that that level of service, the quality of care that's available in Howard County, is available in Allegheny County, in Garrett County, in Worcester County. Part of our job is to promulgate the clinical protocols that EMTs and paramedics are using. So when you travel outside Howard County to visit somebody or go on an excursion, you can be assured that the people that are available to come help you there have the same qualifications and the same intensity of dedication that exists in Howard County.
What kind of challenges do you face making this happen? This is such a broad and various thing.
Well, there are 20,000 people who are out there doing this work in Maryland. I mean, we're enveloped by folks who are super dedicated all the time. But 20,000 sounds like a lot, but on many days isn't quite enough. We have benefited over the course of time, decades, of folks who are dedicated volunteers. And volunteerism is a tougher concept these days. People want to be remunerated. Society has evolved over the course of time. It's hard for people to work a full-time job with all that's expected and also be a volunteer in their communities. Most of the EMS services in the state and commercial ambulance services who also are folded into this milieu are struggling to recruit the people they need. And so a challenge is getting people interested in emergency medical services as a career and making a go of it and staying with it. It's hard work. It's tough to see the things they see and come back to work the next day. It's challenging, and it's not inconsequential what's required to stay up to date on all the evolution, the changes in the quality of care and the science behind it. It isn't sign up and check in and go staff an ambulance and just feel good about it. You can be on your game.
Well, so many things are changing digitally today. I wonder how that affects EMS.
Well, a couple different ways. Probably the most direct is the way that we acquire information. So in terms of, I mentioned the continuing education that's required of the EMTs and paramedics. It used to be that you go sit in a classroom and do that. Now it's quite awesome that they can be on duty at the station and they can log into a continuing education program and they can get the necessary education they need while they're on duty, for example. That's super helpful. People in Maryland, we benefit from an electronic medical record and a health information exchange, so that when a person encounters the healthcare system, there's a record of that lives with them and is accessible by any practitioner that's taking care of them downstream. Well, one of the things that we're working on is the availability of EMS folks, the EMTs and paramedics, to access your record when they see you instantaneously. And that is super helpful, because if you're not able to speak for yourself, or you can't recall an important feature of your medical history or what medications you take, we're working toward the availability of that information for EMTs and paramedics on the scene. So they can tell where you go to usually get your care, and we can help facilitate continuity of care. But what's important is every encounter with the EMS system by a person results in a similar record. So we benefit from a statewide electronic medical record for emergency medical services. So when you encounter a paramedic and they make a record of that, it's going into your permanent health care record. So a physician who's taking care of you days later, if it's relevant to your care, can see that you encountered the EMS system and what care they had rendered.
Wow, that's amazing. So, do you have plans going forward?
Well, we're operating on a roadmap that we call Vision 2030. Right before COVID-19 struck us, we had assembled more than 200 EMS stakeholders around the state, and they got together and they created this roadmap, Vision 2030, that's sort of our strategic plan. We're a little slow out of the gate, inhibited by COVID-19. We've done a lot and been really integral to the state's response to managing the pandemic. But some of the other things that we've wanted to do have been on the back burner for a little bit. But Vision 2030 speaks about our people power, making sure that our EMS clinicians are rewarded and that we have the right numbers and that they are as qualified as they can possibly be for the expectations we place upon them. It has to do with clinical care and making sure that we're continuously up to date and that the care that's being provided in the field has the most sound foundation in science that it possibly can.
If somebody wants to know more about MIMS, how would they do that?
Well, they can go to our website, www.miemss.org.
And it's all there?
Well, there's a lot there.
Okay.
But if it's not there, there's links to things that they can find.
Is this 2030 plan there?
The 2030 plan is there.
That's all very amazing. What can people do to help MIMS?
Oh, prevention is, an ounce of prevention is worth a pound of cure. That's what they say, right? We struggle on any given day with folks who encounter the EMS system and really didn't need to, or they wouldn't have needed to had they exercised some degree of prevention ahead of time. And right now, the challenge is influenza. We are, every year since COVID-19, we've been concerned about this notion of a triple pandemic, a triple-demic, where people get COVID-19 and flu and other respiratory viruses, and it overwhelms the healthcare system. And we have had some uncomfortably close encounters with that potential over the course of the past couple of years, but people haven't gotten the flu because all the preventive measures they were taking to not get COVID-19 helped also them not get the flu. This year is a little bit different because people are so much more relaxed. And so they're not wearing masks and they're not paying as close attention to washing their hands as much as they were. They're being a little bit more liberal about going out when they don't feel well. All those things are, good in a sense that we are accommodating life with a virus that is going to live with us for the foreseeable future. But it also means that we're susceptible to all those other things that we were susceptible to long before there was COVID-19. And the combination of all of those things is making the emergency care system in the state really challenged. Our hospital emergency departments are super busy. They're available to take care of life or death situations. I mean, that's their raison d'etre. But when people go with viral symptoms, it gums up the system, and it makes care challenging to access for everybody. So my message is, please, 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 please get a flu shot. And if you haven't gotten a COVID-19, well, if you haven't been primarily vaccinated, it's long over time. And if you haven't been boosted, please, please, please do that. Those things, COVID-19 vaccine and influenza vaccine, are the best way to prevent serious illness and not overwhelm the healthcare system. We want the system to be available for people when they truly, truly need it. And if you can avoid needing it ever by doing a couple of simple preventive things, it just makes the most sense.
Does it make sense to continue to wear a mask?
Well, the CDC recently suggested that that's the right thing to be doing, especially in crowded environments. When you're in a place where you can't predict who you're going to be close to, wearing a mask makes sense. It's easy enough to do. And there might be some seasonal benefit to that, meaning when we're all congregated indoors, especially this time of year, it's an easy preventative thing to do. And although it's obnoxious in a sense and speaks to our inability to get back to the normal that we knew in 2018, for example, it's simple. and not that inconvenient when you think about it.
Dr. Delbridge, I want to thank you for the members of AARP, for the members of the state, for what you do, and for what MIMS does. It's just mind-blowing what activity goes on under your command, and I'm proud to have the opportunity to talk with you this morning. Thank you very much.
It's my pleasure. And again, it has very little to do with me and all to do with the 100 or so people that work here and the 20,000 EMTs and paramedics that are out in the field every day.
Thank you.
You're welcome.